Hello, my name's Dr. Joshua Wellington. I'm here at the American Pain Consortium Center for Pain Management with one of my dear patients, Ed, who we met recently about a year ago or so. And we're going to have a wonderful discussion today about advanced pain therapies, focusing on targeted drug delivery with the use of implantable pain pumps. My background, I'm a physician specializing in physical medicine and rehabilitation, and went on to subspecialize in pain medicine through fellowship training at Harvard. I've been in Indiana now for 19 years, going on 20, and have really made it my focus to try and help people's quality of life improve to the best possible through advanced and interventional pain therapies. So we're going to focus on one of those therapies today, targeted drug delivery with pain pumps. And Ed is with us to share his story because it is unique, but I don't think different from what many people can experience living with chronic pain. And so this is just one example of how someone who dealt with devastating injuries was able to come back to life and literally, figuratively, spiritually, I think. And
Definitely.
I've been blessed to be part of Ed's life and help improve his quality of life. So Ed, do you want to talk a little bit about kind of what brought us here today?
Yeah. Well, thanks for having me. I appreciate it. I was in a pretty devastating car wreck in 2017, and one of those wrecks that every doctor that worked on me would tell my wife that they don't know why I'm alive, and so it left a lot of residual stuff, and I. I think your surgery on my pain pump was my 23rd operation in relation to the wreck. And I mean, the doctors, again, I'm the guy that shouldn't be alive, and I'm alive. So thank God, there were a lot of miracles that happened there, but there was still, there's only so much that the medical world can do. So for six plus years, I had, devastating pain. I have metal implanted in every limb in my torso. I mean, it's everywhere. And there's nerve damage that was just progressively getting worse. And I was to the point where I was pretty debilitated. I mean, I was back to using a cane again for this phantom pain in my knee that no doctor could explain. My back, my neck, my ribs, my just a wreck. And I had seen from the time of the wreck. I think you were probably the fifth pain management doctor that I went to, and really my wife found Dr. Wellington, and she was probably a bigger proponent of trying to help me than I was myself. And what we were finding is we were going to pain management doctors, and I had been to two, and one of them came up with 107 injections a year, and the other one came up with 109 injections a year. I mean, like of all different kinds, and some of them are really painful. And you break that down, and you're like, that's two a week for the whole year, no vacation. And we were really trying to medicate, with different pain drugs, and I just did not tolerate any of it, even the things that weren't pain drugs like gabapentin and Lyrica, which that's where you came in. At that point, we were having trouble finding a doctor that really did pain management and managed medicine. Most of the pain management doctors, they just they just do injections.
And as I recall too, you really did not want opioids in
No,
particular because your job had been a pilot with
yeah,
FedEx
right.
for years.
Yeah, so I mean, I lived a life of never, there was no drug whatsoever that I had ever tried or done. And any time that I took pain medicine after operations and things like that, they made me incredibly ill, and they just made me feel bad. And I'll be honest with you, I'm the guy with whatever system I have that doesn't understand how people get hooked on them because they're so awful for me.
Yeah.
And then the side effects were so bad, and I couldn't remember how to get to the grocery store, and when I was there, I couldn't remember how to get home, and it was a pretty bad. And so we came to you, and you tried to manage medicine. And I remember the first day we met, you said, "Hey, you're a candidate for a pain pump." And I said, "Yeah, I don't know about that, because that idea of having something placed inside me was like I don't know. I didn't like that at all.
Which is
Um,
ironic because you still had so much metal in you from
yeah,
both legs and
yeah,
arm.
yeah.
There's quite a bit of metal before I came along.
Both arms, both legs,
Right.
both arms, the
Yes.
hip. My, like I said, my
Your
torso, my
pelvis,
ribs, my
torso.
pelvis,
Hmm.
everywhere. And I don't know that it was necessarily the idea of having more metal. It was the idea of having a machine in me,
Yeah.
right? And it kind of freaked me out a little bit. As a pilot, I work in a machine, and the whole point of having a pilot is to train him to how to fix that machine and get it back on the ground safely. So in my world, machines fail, and like I don't want this thing in me, right? And there's probably some other things in there that I've never really looked at psychologically. But it got to the point, and again, I did a lot of prayer on this, and it got to a point spiritually where God answered a prayer that I actually made in church on a Sunday, and on a Monday I get a phone call out of the blue from a guy that I haven't talked to about this at all, and he says, "Ed, whatever you're doing," so I have a little bit of a ministry on my own, a spiritual ministry. He said, "Ed, whatever you can do to help you alleviate your pain, you need to do because you need to be around for the long haul." And there were a lot of side effects from the pain that were causing other issues in my health, from lack of sleep and all kinds of things. And so I considered the timing of that, and I called you the next day and said, "Okay, let's schedule the test." And the test worked phenomenally well. I think you said it worked really well.
Yeah, it's remarkable, and I think a beautiful feature about targeted drug delivery with pumps is that you can actually test it out. And what we did was essentially a spinal injection of a small amount of pain medicine, and we used Dilaudid, I believe, that worked remarkably well because in the spine fluid, to explain to people, medicine is 100 times more potent than a pill. And it basically stays in that area of the spinal fluid and spinal cord, so it doesn't go up to the brain.
Right.
So it doesn't cause cognitive side effects like you'd
None. I've
suffered
had
from.
none.
Right,
Yeah, I mean,
right.
it's amazing.
A clear head.
Yeah.
So oral medicines that can cause so many side effects and problems, this targets the therapy to the area of the spinal cord where you need the pain relief with incredibly small amounts that are remarkably effective without all those side
So,
effects.
me being a science guy, that's my
Yeah.
background, a science guy, physics kind of thing. I calculated the dose that I was getting, and it did. It came out to 1/100th.
There you
I
go.
take 1/100th of a dose every day,
Remarkable.
is what the pump is delivering to me. And I will say to the people that are out there wondering, I sleep now, and it is amazing what's sleeping when you haven't slept for 6 years.
Yeah.
But like, my blood sugars were going high. I was pre-diabetic. I mean, I was gaining weight. I mean, you can name the things that were wrong. My blood pressure. So my blood pressure, we had to start bringing me off of it now because I was going low. And we're completely rid of one of the medications, and it hasn't changed anything. It's still going low. And so we're slowly weaning me off of, and I didn't realize that pain can cause high blood pressure, and lack of sleep can cause it. And so, yeah, to the people out there, like, I sleep now, it's crazy. I could never sleep more than 2 or 3 minutes. We actually did a sleep study in all of this, and they found that I wake up 92 times an hour before. So that's like, I think I figured out like 38 seconds or something in between each wake. And so there's never any deep REM sleep. And so,
Before the pump,
Before
you
the
just
pump.
never had sleep.
and I slept that night. My wife told me, she's like, you didn't. I used to have like crazy bedhead because I was like an alligator, and I would just roll, right? Because you just can't get comfortable. And I woke up. My wife said, I was actually worried about you. She's like, because I'm so used to you rolling. She's like, you didn't move, and I kept thinking, oh my gosh, he's dead. And she said, I kept touching you to feel that you were breathing, and remind me about touch. I want to mention that later in the story. There's another story about touch that I want to share
Okay.
with your folks there. But the pain pump has been absolutely fabulous. And so after the test, I still had that period. You said you got like the insurance is going to cover you for a couple months for you to make this decision. And so I still wasn't on board, right? And I started looking at videos. I looked at all these videos, and the videos that are out there show In my mind, they were way worse off than I was. I mean, they have a pump in them, and they can't walk and they can't do anything. And I remember you saying, "Yeah, see, that's not what we're giving this to you for. We're giving this to you so that you can get your life back."
Right.
After the pump was put in, it came back. I walked in with a cane,
Yeah.
and I walked out without one. And you didn't work on my legs.
Right.
It was that phantom knee thing, right? That no one can find, because well, we did find that there was nerve damage there, and so it was, and I had on the other leg, I had what presented to surgeons as a torn hamstring. It behaved like one. It curled up like one. It was cut and dry. But when I did the MRI, it wasn't torn.
Yeah.
That's not torn anymore. That fake tear it's gone. It was a nerve thing. So amazing to me, the difference of what I could do. Now I'm going to also be honest. I am not 100% pain-free, but I used to run around on what probably was a 10 for normal people. That was my just normal waking up.
I think that's a good point too, that there is no panacea, there's no magic.
No.
You know, pumps can be remarkable in changing quality of life.
Yeah.
It's all about making it manageable so you can do what you want to
So
do.
for me, the things that used to hurt me, they still do.
Yeah.
Except before, when I did something, like say I had to do laundry. Well, I did laundry for an hour or two, and then I was done for 3 or 4 days.
Yeah.
Because just the idea of bending into the machine and pulling the stuff out and carrying it in and folding it, like that was it. I could do a couple loads, and I was done for 3 or 4 days, which is kind of a hard thing when you're still relatively young, and you know, my dad's 80 some years old, and we could compare about what we could do. I was living the life of an 80-year-old man.
Yeah.
And I was 50. So now those things still bother me, except it reminds me more of when I was young, and when you do something that's really hard, and like, oh wow, man, I'm going to feel that, and then like an hour later you're out doing it again because that was it. I have a recovery time now, and it's fast. I can recover and I can do it. When I can look at doing things and saying, I'm going to do that, and I know it's going to make me sore, but it'll go away in a normal time as the body rests, relax, sit in a different position, take the weight off for a while, and then you can go back to it and
Not be down for days.
right, yeah, and not even. And the thing is, the quantity of work that I can do, and even the quality of it. I mean, again, I have a clearer mind because I'm sleeping again. And the other thing is, pain is distracting. It's incredibly distracting, and when you're living in a level of pain that it's just dialed all the way up, it's hard to focus on anything else. And so, I found relationships have gotten better. And it isn't. You mentioned this, and I was hoping you would. For me, it's not just one thing. The pain pump has been, I will call it miraculous, but it's thing. I still have a chiropractor, and I recommend a good chiropractor. My chiropractor demanded to see all of my X-rays and my MRIs, and he has parts on my body that he says we will never touch. And if anybody but a surgeon says they want to touch it, go away from them. Right? Because he said you're fragile in places on your spine, so don't let anybody manipulate you. But there are other places that he can work on. So I have him. And the other big thing, probably the biggest thing, is your spiritual life. I mean, until you get your spiritual life in order, your body isn't going to heal. And so, oddly enough, for me, it took a great amount of pain to learn that. And so I'm very blessed, and I'm very thankful for it. I'm thankful for everything in it. I had such incredible spiritual experiences throughout this ordeal. I would never change it. But if I tried to do this without adding that spiritual side into it, without bringing God into this equation, and the idea of that there are some good things that do come from suffering if you approach it with the right idea and with the right spiritual heart. And I just encourage people to look at that. It isn't just a pump. It isn't just a medication. It isn't just a chiropractor. All of that's great, and all of it together. But bring God into it with you. And for me, that was life changing.
I think you bring a good point, and really the approach that I try and treat people with is to treat the whole person.
Yeah.
With everything they're bringing to the table, whether of course the pain, but also what's going on in the mind, what's going on in the body, what's going on spiritually, everyone may be bringing different
Yeah,
things. People may be lacking in certain senses,
exactly.
but you just have to recognize that each person is walking their own journey.
Yeah,
And what I can try and do to help with what I see, the talents that I have to be able to improve someone's quality of life, that's going to have a ripple effect
yeah,
because by touching your life, it's like that pebble in the pond that just starts to spread the ripples, and now you're able to do so much more and
yeah,
touch other people's lives.
yeah. And not only am I able to do more, I'm able to do it in with a higher quality.
Hmm.
I said quantity before, right? I could do more of it, but what I do now, I can also do it with more focus and attention, and because the brain isn't full just thinking about pain.
Hmm.
And so that's great. You brought up touch again, so it's a good segue for me at least.
Yeah.
I've been operated on 23 times. I mean, with this wreck. I've had other operations before it, so I think I counted up. I've had 26 or 27 total in my life.
Pretty good count.
It is, it's pretty good. I'm
Yeah.
good with that being the last.
Yes.
However, I've been sedated so many times that I have no idea how many, because there were even times I was sedated when I wasn't being operated on when I was in the wreck. Um, you did something that no doctor had ever done, and as a result, I did something that had never happened before as well. So I thought I'd share this with you. Um, as the anesthesiologist was about to put me to sleep, and he said, "Okay, Ed, I'm going to give you some gas. You're going to feel a little funny and all this stuff." You stopped what you were doing. You were working on something.
Mhm.
Your back was to me, and you walked over to me, and you placed your hand on my arm, and you said, "You're going to be fine." I've never had any doctor do that, and so I said a prayer for you
Mhm.
at that moment, and I went to sleep, and I woke up. Now I have prayed when I was going to sleep 23 times. When I woke up, I was still praying. And that was like the coolest thing. I'd never experienced anything like that before. And it was like, wow. So I can tell you that you talked about the touch, physical touch. Um, that's something very special. It's something very unique. And it touched me to the point where this was in April, and what is it, August now, 4 or 5 months later. And it's still front and foremost in my mind. And then it goes back to what you were saying. God calls all of us to touch each other, right? We're all his children. And I was living in a way that while I was trying to do that, it's really hard to do that when you're just saturated in pain. And so now I'm free to um, do things. I'm going to Cincinnati tomorrow to give a talk on the same day that I'm driving down. See, that was something that couldn't happen before. I had to drive down the day before because that would wreck me.
Yeah.
And then I'd do the talk and it would wreck me because I had to stand for an hour or two. And then I would have to wait and I would have to drive home the next day, which would wreck me again.
Hmm.
And now I can drive down there and drive. It's a 2-day talk, but if I had to, I could drive down and back in one day and give the talk. And so you're touching me, and your talent and your foresight of seeing what this pump could do has affected me in a way that I can touch people in a better way. It
That's
really is. It is quite amazing. And
wonderful.
I went from being, I wasn't on board. I wasn't on board. I was doing it for my wife when I went under.
Mhm.
And I remember the day of the operation. There was a tech. She was there and she was talking to me back here, right? And I've tried, because before I couldn't turn my head further than this. And she was talking to me, and I said, "Oh, ma'am," I said, "Can you please come over here?" I said, "I can't turn my head that far." And so she came and she finished conversation here. And so when I woke up, wherever they put me, the nurse was in the same spot. And I remember looking at her. And then I thought, "Oh my gosh, that's right where that other lady was." And I was looking at her, and it was just minutes later. It probably wasn't minutes. I don't know how long it took, but for me, it was a snap of the finger later.
Right.
And I'm looking at her. And then I remember standing up to get dressed, and I couldn't put my pants on standing up because I couldn't support my whole body with my right leg. But I was able to do that. I was like, "Oh my gosh, this is pretty crazy." It wasn't like, other operations that you have, that eventually it'll make you feel better. But man, they're really bad right afterwards, right? And for like a couple, but for me, it wasn't. for me, it was like, oh my God, I had this, and I worked with my chiropractor about it. I had this shaft that went from my back through my chest. I swear I felt like I could grab it. It just felt like a shaft. It was gone. I woke up and it was gone. I
Like
went,
that sensation.
yes, right. It wasn't a real shaft, but
Right.
for me, it felt like, I mean, like I could touch where I swore it was something was coming out of me, and the same thing going in my back. And again, it was just nerve stuff. They do, those nerves, they do from some really weird
They
sensations.
can.
But that's been gone, and I haven't had it. I haven't had it yet. So just absolutely crazy how it's a fast. You notice it right away, the improvement that it made.
Yeah, it can be uh, a range. Some people, and it's nice, as we talked about, you can do a test, a trial
Yeah,
for this before, so you knew it worked.
yeah,
You slept through the night.
yeah.
It took a little time to kind of wrap your head around having a medical device in you, but it's been absolutely game
It
changing. And,
has
and
been.
that itself was even an outpatient procedure.
It was.
Took less than an hour to
Yeah,
do. You woke up feeling great.
I did.
Some people, may wake up still feeling their pain because pain is different for everybody.
It is. Yeah,
And the pumps are nice in that they're programmable.
yeah.
We're able to adjust the dosing.
And I've come in and done that, and that's like, I mean, it's
And progressively, we've gotten
yeah,
kind of more control of your pain, which is
definitely.
great. And
Yeah.
as you said too, you're not pain free.
No.
But what you can do now, how it's managed now to
Yeah.
add the quality
Yeah.
and the quantity of what you can do, and that's just absolutely life changing.
And I'm glad I'm not 100% pain free, because I have the mindset that if it didn't hurt, I'd probably go and do things. And like as my chiropractor said, you have some things on you that are fragile. And so like, if I didn't have any pain, I'd probably end up back in the hospital even in worse shape, because, so having a little bit of
A
pain
little
is a good
reminder.
limit. Yeah, right. But yeah, it really is. It's fascinating, and I went into this, and that's why I asked, we talked about speaking, because I was the guy going into surgery that was like, I am not happy about this. And I finally broke down and did it because my wife and kids wanted me to try. But man, I come out now and I like tell people all the time, like, I got this doctor, you got to see him, because like this is crazy amazing. And again, you never want to build people's hopes up,
Exactly.
because you told me that. You said, we don't know, it may or may not work. You even said, hey, the pump may not work as well as the test did, because we administer it differently. And I will say the test worked full scale up and down the spinal column. And you explained that in the test that's expected.
Yeah,
But
because I
the
mix
pump,
up
you
the
mix
medicine
it.
and
Yeah.
the spinal fluid, so
And the
it
pump
does spread a
doesn't,
lot
the
more.
pump doesn't do that. But I
Right.
will say, where I had 100% coverage, I probably have 80 just with the pump. And that 80 being completely at bay. I mean, some of the pain is gone, and some of it's running at a 1 or a 2. And I'm 53 years old. If I had nothing wrong with me by 53 years old, I would have some pain all the time, right? Because
Probably
I have
so.
not been gentle to the body. So, but the other 20% that it isn't, it's taking the edge off, because it was unbearable.
Yeah.
And my neck was so bad that by this time in the day, I would sit and hold it like this. My shirts, we've had to get rid of them afterwards. We didn't before, but I like to have a little beard. As a pilot, I'm not allowed to have a beard. So once I got grounded, I decided I'm having a beard forever. So, but I had to sit like this, and so my shirts are worn out. My beard
Yeah.
wore my shirts out. And so after this happened, it was at dinner that night of the operation. And my wife said, "You're holding your head up." I'm sorry.
It's okay. It's things people take for granted, like
Yeah.
holding their head up, like going to the grocery and not having to stop 3 times.
Yeah. And so
Putting
like,
on your pants.
oh yeah, I mean like I fought over the cart because I used the cart as a walker, right? Because I don't want to use a walker. And at the
Right.
time I'm like, well, let me have the cart, because then no one will know that I'm using this walker.
That's
Of course, my
right.
wife said, you look like you're laying on the cart, so people assume you're using it as a walker. But we didn't get rid of the shirts before, because well, my head covered the worn out spot. And so now when I'll put a shirt on and I'm looking at it, it has this ring that like the color's gone and it's all frayed, and I'm like, oh, I can't wear that shirt anymore. So, we have to throw it away. And they're so bad you can't even donate them to people. They're so worn out. And I think, man, that's pretty crazy. And it went that night at dinner, which is, again, is another thing. I ate dinner. I was starving afterwards, but I ate dinner after. Like it's a pretty. I've had a lot of surgeries. It was very simple surgery, and I will say that anybody that's used to dealing with pain, you put a
An
a pain
on-cue
grenade,
pain.
I call it. It looked like a little grenade,
Yes.
and I had a reaction to it. And you said keep it in for I think 3 or 4 days and then pull it out. We pulled it out hours later, and
Hmm.
everything got better after that. So I didn't take anything.
Yeah.
The pain was that little compared to what I was used to. That the residual pain from the surgery was, if you've had any other surgeries, it's one of the most minor things that you're going
Yeah,
to feel.
that's a good point. I mean, this is an outpatient procedure that's basically just a subcutaneous implant. The pump is just implanted under the skin,
Yeah,
often in the abdomen, sometimes in the flank. This is not spine surgery.
yeah,
To put the catheter, the little tubing into the spinal canal, it's just through a needle, through a small incision.
yeah,
So there's no cutting of bone or muscle. And so people do recover very
yeah,
quickly. And most people don't need any kind of pain medicine because I do use that little pain buster for most people,
yeah.
which is a ball, a little balloon filled with local anesthetic that can squeeze itself down through a little tiny tube into the surgical sites to keep them numb for 5 days, which for people who tolerate it and do well, it's wonderful. But
The
even
idea was wonderful, not having to take anything and have a little bag to
absolutely,
wear. But for me, I had a reaction to it for whatever reason.
but even pulling it out, you barely had any surgical pain.
No, it was pulled out that night.
Yeah,
I mean, I called that night because I was having some pretty
I
bad
remember.
reactions to it. Yeah, and so my wife pulled it out that night, and within an hour,
Yeah,
everything started getting better. And then I was
that's
like, oh my
great.
gosh, if I'd have known that, I'd have told him not even to put it in. So, but it was really easy. And I will say, I mean, just so I'll let your listeners know that. So the site itself, I have mine on the back,
Mhm.
on the flank, as you say. It was sensitive, but most incisions are, and I would brush up against it, and I thought, oh, I'm never gonna get used to this because you can kind of feel this thing. But here we are 4 months into it, and I don't even know it's there anymore. I don't feel it anymore. It it's really easy to forget you have it.
I like that too.
And I'm
I
like,
like that.
it really reminds me of what I felt like. I feel better than I did before. I mean, I have uh, degenerative disc disease, and part of that is from being a pilot and sitting for such long periods. And so I had back trouble for years, which I don't have anymore. I mean, it gets a little sore still, but I mean, it helped things that I didn't even think about it helping. Things that were before the wreck. Like I
Mhm.
look at this pump as something that I did because I was in this horrific wreck. But there were things that I went into the wreck having,
Mhm.
and it's helped them as well.
Yeah, it's kind of remarkable being a targeted therapy where I position the tip of that catheter over your spinal cord just happened to be the right
Yeah,
area
right.
to
Yeah,
cover 80%
yeah,
of your primary pain complaints.
yeah,
And that's different for different people. Some people primarily have abdominal pain from like chronic pancreatitis or Crohn's disease or
right,
other
right.
abdominal conditions, but I can specifically place a catheter tip to help the abdomen.
Yeah,
For people who have primary neck pain, the catheter can go up much higher to cover the neck. Unfortunately, it doesn't cover everything, as you
right.
know.
Yeah,
But if we can take away the worst of the pain, like that
yeah,
80% or whatever it is, and make it more manageable, how much
yeah.
more livable life becomes.
Yeah, definitely. I mean, it really it was a game changer. It is. There are very few things that I can say that I've had operating that were life changing
Hmm.
in a good way.
Yeah.
And this was. It was, and so for the people that are out there on the fence and they don't know whether, I mean, I was the guy. Everything about this pump was distasteful to me. It really, it miraculous. And
Hmm.
I mean that's the only thing I can say is that, and I thank God every day that my wife found you, because I'd have been buying more shirts to wear out with my neck. So walking with a cane and not able to do anything. And so I'm a useful person in society again.
It's nice to get your life back,
Yeah,
for
yeah, it really
sure.
has made.
And fortunately, the maintenance of the pumps is pretty minimal too. I mean, once the trial is successful and the pump's implanted and you heal up, the pump needs to be refilled about every 3 to 6 months for most people. which is an outpatient procedure just right in the clinic. The pump, as you said, is under the skin. So just with a simple little needle puncture through the skin and into the pump, we're able to easily fill it. We can reprogram it wirelessly.
Yeah.
So it just has all of these conveniences. And as you said, you kind of forget about it, which is nice for somebody, I think, dealing with pain all the time when their only other option is medications or injections. Like every pill you take is a reminder that you have chronic pain.
Yeah.
You know, any injection you get, same thing. But this just kind of lets you live your life.
Right. And for me, that taking the pill was, one, it didn't really take the pain away. It took it off. It took the edge off. But it made me non-functional.
Right. It
And
made
so
you so
now I'm
dull.
doubly debilitated. I'm physically debilitated because I can't walk, and then I'm mentally debilitated because I can't remember where I live.
Right.
And and you think, oh my gosh, it was like, it was, for my poor wife, it was like living with a person that has Alzheimer's, because I would tell her the same thing over and over. I had no recollection from one moment to the next that I even just said that. And so that was no life. I would rather just be in pain,
Yeah.
because then you only have one thing you're dealing with. And yeah, it really is. I highly recommend it. I mean, if you think that this is it, and one I'm going to share with you don't know, and man, there's really not a lot of stuff on the internet about these things. So like the reprogramming, I did not. One of the big things is I did not like the idea of having this thing in me that some psychopath could get control of over 1,000 miles away and hack it and do this, right? I mean, because you think about this,
About that.
right?
That
But that's
can't
not the way it
happen.
works. I mean,
It's a
you
closed
guys got to
system.
put this thing right on me. I mean, you're going to know if somebody's like, hold on a second, I need to put this thing on. You're going to know and they got an iPad in their hand. So it isn't what I thought. It
Right.
isn't that
It's not hackable.
some angry worker at the office could get in there and overdose of 1,000 people.
It's not
No,
possible.
you got to have the little antenna right on you. So that was a big thing for me. I know, and I thought that going in. Like even after we got in, until I had my first adjustment, I really thought that's the way it worked. Because there's nothing out on the internet on how that happens. And so that was one of the big things I didn't like, right? I don't want somebody to be able to access this. They can't. You got to be in the office, and literally, I can't even find it myself. They end up having to do it for me. So,
It's very safe in that regard.
yeah, it is. And I've had a few adjustments. It's really easy. There's not a bit of pain, and I haven't had a refill yet. I'm 4 months in, and I don't. I mean, I've been so blessed that I'm using such a small dose that
Right.
I think I could. It was like 9 or 10 months that I could go
Right.
if. I know that you said there's like a 6-month limit
Yeah,
on the medicine.
Yeah, the stability of the medication we change out every 6
Yeah,
months.
so-
Even though somebody like you could go 9 months, maybe
So,
longer.
we did it in April, and the little readout. The machine's pretty cool. I mean, it like tells you how much you've used, how much is left, and I could technically go till I think the end of November. So April to the end of November so I'm on a really low dose, and it's working so fabulously for me. And I understand everybody's going to be different, but
Of course.
that was one of the things that really worried me, was I didn't want people to have it. And really, I thought I'm going to feel it all the time, and I don't anymore. I don't feel it in my body. I'm used to it. You did a perfect placement. I can sit. I've really not found a place or a way that I could sit and it bothers me.
Good.
So
It's very purposeful. And I do that, as with you, with every patient, because every patient's body is different.
yeah,
It's
and you
finding-
did. You wanted to do it up front, and then when you looked at me, you said,
Initially.
"Man, that's not going to work well."
Right.
And you said you put it around on the back. So, and I'm glad, because it would have looked silly.
Yeah.
And my wife just said it today. Actually, she was talking about it, and she goes, "You really can't even see that unless you really look for it."
Mm-hmm.
It really, yeah. It's I really haven't. I can tell you, I've had a lot of operations, and I've always had something that I was like, I wish would have been different. But this has been fabulous. I wouldn't change a thing.
That's great.
And I would do it again now. And I encourage people that are on the fence for the same reasons that I just said, that it really was, I was concerned about things I shouldn't have been.
Yeah, I mean, I think that's the best testimonials. You do it all over again.
Yeah, oh, yeah, in a heartbeat.
In hindsight. And it is, it's going into that unknown. As you said, there's not much information on the internet, and some of the information that's out there can be scary. I
Yeah,
think even on some company websites, it says, there's going to be a 6-inch incision. I mean, that's
yeah,
not real.
no,
It's maybe 2.5, 3 inches at the
yeah.
most, just big enough for the pump, which is about the size of a hockey puck.
Oh, that's what I tell
So,
people I have. I show them.
yeah.
I'll say, "Hey, if I lean a certain way, it becomes prominent. So I say, hey, do you want to look at my hockey puck? And I've told kids that I went to a hockey game and like and,
Took one in the
and
side.
most people believe that. So you can have some fun with it.
Yeah.
Again, a lot of this stuff about pain is all about attitude, and so
Yes,
um,
you're
you know,
absolutely right.
so yeah, it's good to have fun with things like that. But
Well, the best medicine is laughter.
oh, without a
And
doubt,
having a good attitude
yeah,
really, I think, gives the best prognosis for patients.
yeah.
I mean, I've seen that time and again
Yeah,
that for
and you know,
people.
I get it. I mean, like chronic pain, it it um it never subsides, it never quits, and unless you've suffered it, it's hard to understand what chronic pain at a high level is, I could see where it would inspire like a hopelessness and things, and that's why I said spiritually, you need to get into it and bring God into this, and because there is some good that can come from suffering if you change your attitude and your mindset about suffering. And for me, that was until I found you, that was the best thing that got me
Yeah.
to where I was. And so it is multifaceted. And I would try to do things before, and I'd be in chronic pain, but I'd still try to do them. And my kids, which my kids are older, they're not kids anymore. They're all, well, one's out of college, two are in college. And I would be doing something and I would say, does this look like it hurts? And there's, you look horrible. And it would make me laugh because I would think about it. I'm like, well, if people saw me doing this, they'd be like, oh, that poor guy. And I'm like thinking, well, I'm not a poor guy. I'm just, I'm just out doing it, And
Yeah.
so yeah, humor is the attitude, the humor, and the spirituality. They are key. You have to have it.
Hmm. Very good medicine.
Yeah.
And I appreciate you sharing your experience, Ed. I mean, this is a remarkable therapy. It is truly a niche therapy, though. Targeted drug delivery has been around for over 30 years,
Yeah.
which many people, when I tell them that, are shocked
I am. I
because
was. Yeah.
it's really not that well known.
And try Googling it. You're going to find nearly nothing
Right.
on it. And the
Right.
ones you do find, because I spent months,
Hmm.
the ones you find are going to be people that are on the pump. And you're like, well, they're worse than I am, and they're on the pump. What's the point of doing it?
Yeah.
But they must be just train wrecks,
And
right?
you have to
Without
recognize, too, I mean, who are the people that post on the internet? It's ones with negative experiences,
Yeah.
too.
Yeah.
But by and large, most people who go down the road of targeted drug delivery are significantly better than where they were before
Yeah.
that step. And recognizing that it is such a niche therapy that a lot of people aren't aware of, that a lot of physicians aren't even aware of. I'm really glad that we can do this today to try and raise the visibility and awareness
Yeah.
of it, because the more people who are aware, the more physicians who are aware might consider it as a possibility, because there's really nothing to lose and so much to gain
Yeah. Yeah.
when just even considering a completely reversible trial.
Yeah.
Does it
Exactly,
you
right.
know,
Yeah.
does it make your
And
pain
and for me,
better?
it took away the pain, but taking away the pain allowed me to. I've lost almost 10 pounds. I didn't try to lose 10 pounds. I mean, I eat horribly, and I still eat horribly, but I can move now.
Yeah.
I lost weight. My blood sugars are lower. I sleep better. My blood pressure is lower. These are all things I didn't even think about the pump doing, and maybe it wouldn't work for everybody, but maybe that getting up, losing some weight, being active again has helped with all of these things, because I couldn't do it.
Right.
So yeah, it helped in ways that I didn't even think it would help.
Yeah, it's remarkable how
Yeah.
getting back
It's been
to it.
awesome. I appreciate the opportunity to share.
Yeah, I'm glad you could today.
Yeah,
Me
thank
too.
you.